8.2 Health Consultation, Ruben Chilcott. The first thing I did with my client after welcoming them was outline what would be happening, sort of what was going to go on during this health consultation. And then once we did this, we moved on to the questionnaire. So the first section was just personal details, making sure we got everything. So name, age, date of birth, postcode, telephone number if I need to get hold of her for any reason, mobile phone number, same sort of thing, and email address. Then straight away we went on to the goals. These are the main things for coming here. She just said she wanted to change her lifestyle, lose a bit of weight, and we worked out if she was planning to make these changes. If she had before, she hadn't before, and she plans to make them straight away. Then we looked at physical activity. We worked out she doesn't really do much physical activity, but she did used to play netball, which I can use in the future to maybe help her reach her goals. And work life, she works in the office at finance. Worked out this was full time, but it didn't really involve any heavy lifting or anything like that, but it does involve sitting down for long periods of time, which causes her backache often, as we worked out. And it's only a mile away and she drives, so we're also going to use that. Nutrition wise, she has 2 to 3 substantial meals per day because she usually skips lunch. Takeaways twice a week. 2,500 calories, which we worked out might be a bit too much for what she's trying to achieve. And then other things like she has a lot of coffee, which also affects her sleep, as you'll see later on. Lifestyle wise, pretty okay. She's quite stressed sometimes, which sometimes affects life, like with less sleep and a bit less patient. And she doesn't drink too much alcohol, only on occasion. But she did smoke every day for like 3 to 4 times a day since she was 14. And she wanted to change these habits. So she was getting 6 to 8 hours sleep, which is quite good, but she does struggle to sleep sometimes, and I feel like a reason for that might be because of a lot of caffeine she has, saying she has 3 to 4 cups of coffee per day and 1 at night. She also said she woke up in the night quite a bit, or normally thirsty and dehydrated, and didn't really feel refreshed after her sleep, which made her less motivated throughout the rest of the day. Then medical history, injury-wise, no prescription medicine, no allergies, but she does have pain during exercise in her back and her neck, and has migraines/headaches sort of once a week. And she did have a major injury in the last 3 years, which is whiplash, which is probably why her neck still hurts. And she also fell down the stairs, so she had some broken toes. After this, I just made her fill out a sort of informed consent type thing, just to make sure she's okay with everything and she had answered everything correctly, otherwise I can't really do my job properly. And just making sure she was going to be okay with the test I was about to carry out, because obviously it involves touch around the hip, so you have to make sure that I have this consent. Once I'd completed the questionnaire, I decided to evaluate everything, so her strengths and weakness. So I cut up into different sections, like you can see. So goals, physical activity, nutrition, lifestyle, so like smoking, stress, alcohol and sleep, and physical health. So you can see in the goals, she has quite a lot of strengths in the goals. They're realistic targets, and she's not expecting an instant change, which you can't, because if you're expecting an instant change, you're going to be disappointed. But I did work out it was quite vague what she wanted, so just losing weight, nothing too specific. So that's a bit of an area to improve on. And physical activity wise, she is going on walks, which is good, so that is a strength. But overall, she's probably not doing enough physical activity, especially to get where she wants to. She doesn't go to the gym, doesn't do any type of sports, and these walks aren't often, so probably not enough. And nutrition wise, although there were a few okay things, there was quite a few areas for improvement. For example, calories consumed, it was 2,500, and this is over the average intake for a woman, which I think is 2,000. And also she was only consuming 1 fruit per day, other than obviously the 5 that you're meant to be doing. As well as this, a lot of coffee was being consumed, which, as well worked out, was probably affecting her sleep. And she was also drinking less than the suggested water, which is 8 cups per day, which is probably why she felt dehydrated in the night sometimes and woke up because of it. So these are all things that are areas for improvement that we might need to change or look into changing. Then on lifestyle and smoking, there was definitely a few strengths. So she doesn't drink alcohol regularly, and she does get a good amount of sleep, despite her struggling to fall asleep and sometimes waking up in the night. She still is getting about 8 hours of sleep, which is pretty good. But again, there's quite a lot of areas to improve. Like, she has fairly high stress levels. Ideally, we'd want to lower these so her life is just easier day to day. She is, like I said, waking up in the night often, struggling to get to sleep. And she smokes regularly, which is definitely something that needs to change. She's struggling to stop, and she's been smoking since she's 14, 3 to 4 times per day, so that's definitely affecting the body in a negative way. And definitely something we'll look to improve on. And also she drives to work, which I spotted as something that maybe she could change in her lifestyle as we look at it later on to help her a bit. And her physical health, everything was fine, so quite no really bad weaknesses, everything sort of working fine. But a few areas maybe is she is still feeling pains in her back and neck during exercise and is still getting migraines, so we might look to try and change these and make them better as well. Of course, I had to point out that some things can't be changed, obviously, like age, genes, ethnicity, anything that, like genes, for example, if there's, I don't know, heart attacks in the family, these are sometimes difficult to change. But you can definitely change stuff like exercise, how much alcohol you're having, how much smoking, and all of these can affect what your heart rate will be and your blood pressures. These are all variable, and they're decided, like all these things are decided by your lifestyle choices. I then moved on to some health checks, health screening checks and tests to see sort of where the body was at for her and stuff. So the first health test I administered was a heart rate check. Of course, I had to ensure that the test was valid and reliable, so I carefully outlined the procedure before beginning. Firstly, I got my client to hold out a hand with the palm facing upwards. I then placed my middle finger and index finger of my hand at the base of the thumb on her wrist until I could find her pulse. Once this was found, I then counted the number of beats I felt in 1 minute, which obviously I timed, and started recording. And this number is her heart rate, so in this case it was 95, which I then compared to the norms of her age, and the results are shown above in the PowerPoint. As can be seen from the bar chart, her score is a lot higher than the average for a woman her age, and significantly higher than an athlete. However, that is expected. This highlights the fact that the heart rate certainly needs to be improved, as it's much higher than the average for a woman her age by about 20 beats, which is quite a bit, and it's very unhealthy, and it could be risky. It could cause her to have a heart attack, so it's important that we make changes to lower this. The next check I did in my client was the body mass index check, so BMI. To carry this out, I first measured her height, as you can see in the pictures in the PowerPoint, and the weight you can also see of my client, which came out of 160 centimetres and 10 stone 1 respectively. Using this data and other data such as the age, gender and average amount of exercise that I found out during the questionnaire, I inputted these values into the NHS BMI calculator to find out her body mass index. The score came out as 24.9, which, although is considered healthy, is considerably close to unhealthy / overweight, suggesting that she is very close to becoming overweight. This suggests that perhaps this is also something that needs to be changed, as ideally she'd want to be further into the healthy zone, so more to the left as you can see on the chart, more into the green. And to do this she'll need to lose weight, which is one of her goals, so this is good. The final check we did was the waist to hip ratio check. To measure this, I just asked my client to stand with a good posture and breathe out. I then measured the circumference of my client's hip and waist and then recorded the results. I divided the waist measurement, which was 0.93, by the hip measurement, which was 1, to find the result, which was 0.93 when you do the maths. And this is considered average, so although not brilliant, it's probably the best result of the 3 checks, as it is average. It's not something that's going to be risky for her, affecting her in a bad way. So just to evaluate the health screening tests, resting heart rate is definitely something that needs to be improved. It is very high for her sort of age, and that just high for her, and it's very, very risky to have it that high, and you'd want to lower it to stop it from perhaps increasing even more and then becoming a real problem. BMI, it is considered healthy, so that definitely is a strength of hers, However, it is very close to being considered overweight. So that is also something we can look at, because obviously she wouldn't want to be going overweight, and the way her goals are set out, she'll want to be going more into the healthy, into the green zone. And waist to hip ratio, which is about average. So compared to the other two, this is definitely a strength I'd consider. So yeah. The first recommendation to my client is to improve her physical activity, as it became clear that there were many areas for improvements when evaluating our answers from the questionnaire. Sorry, I forgot to say, once we evaluated the strengths and weaknesses of both the test and the questionnaire, I made 3 recommendations and strategies to help improve parts of the questionnaire and parts of the test, so improve the overall scores on the test and stuff. So the first recommendation to my client is to improve her physical activity, as it became clear that there are many areas for improvement when evaluating her answers from the questionnaire. During the questionnaire, it became clear that a goal of the client was to improve their overall physical activity to become more healthy. In addition to this, she also mentioned that she had relatively high stress levels. Therefore, I believe that a good target to set would be to improve her stress levels and physical activity through walking the distance to work and back, which I learnt was a mile during the questionnaire. I recommend this to be done at a relatively high intensity of 50% of her max speed, which is quite high for a walk, so that she's walking at a brisk pace. This can be done 4 days of the week, so it's not that much of a sharp immediate change that will put her out of it, as she will get like 1 day off, or 1 day off of work where she can just drive, sleep in a little more some days, which is important to keep her motivated and interested. Furthermore, not only will this allow the client to exercise a little more most days, but it could also act as a stress relief, like I was saying, as it has been proven that walks often release stress and anxiety, whereas driving could often do the opposite. This whole strategy could then be tested, or it will be seen as an improvement for a second measure of the heart rate, as overall this strategy, as well as improving lifestyle and stress, should also improve the heart rate, as these are 2 factors that affect it. A realistic target would be for the heart rate to fall from around 90 beats per minute to a more healthy 85 beats per minute after approximately a month, 2 months' time. This could also perhaps be measured with a second measure of hip to waist ratio, as this addition of exercise should also help lose weight, and this may be noticeable with the test. Another strategy that could improve both my client's physical activity and stress levels could be encouraging her to join a netball team, as she pointed out in the questionnaire that she had previously played and enjoyed this sport, however for whatever reason stopped playing it. This would be a great strategy, as if she joined the netball team, she can enjoy as if she joined a netball team she enjoyed, not only would she get in 2 to 3 extra days of exercise for training and matches, but it could also improve her overall mental health, as sport is often an escape for many people, and she may also make new friends. This will most definitely decrease her heart rate gradually, like same as before, and will be highly likely to lose weight, which she also wanted to do.